Type of hip joint are going to be ball and socket.
Ball and socket.
The importance about the hip joint is that when we speak about the clinical importance, we should know that the hip joint very common to fracture in case of fracture neck of the femur. Fracture neck of the femur, common question. It tends to do avascular necrosis or male union. Why?
Because of the blood supply to the head of the femur.
Because the blood supply enters from lateral.
So it goes actually under the capsule.
Yes. So the blood supply go through the capsule. So injury here, fracture here, will lead to damage of the blood supply to the head. So any fracture neck of the femur usually require complete hip replacement in case of avascular necrosis, especially in old age. So the head of the femur supplied by two blood supply, retinacular arteries, which come from the medial circumflex femoral artery, and also from the obturator. Obturator, they give acetabular artery, which go through a ligament called ligamentum teres. So the acetabular artery and the retinacular arteries both will be running within the capsule. So injury here will lead to cut the blood supply. So the repair will be damaged. Okay, for the dislocation hip joint, which is more common, upward dislocation or downward dislocation?
Downward and medially.
Actually, it will downward posterior 100%.
Upward.
No. Sorry, because they take up muscles actually posteriorly, so actually more.
Yes, more anteriorly. And if you can see for the anatomy, you can see that the socket is a little bit open inferiorly. So it will be inferiorly and anteriorly. Okay, because of support of that muscle posteriorly. But sometimes it could dislocate upward also. Sometimes it could dislocate upward also.
When there is fracture to the
That's not common. Okay, but main dislocation will be inferior and anterior. Okay. For the femur, for the hip joint. So the hip joint capsule, very important, attachment of the capsule. Question, Professor Rigid. It tells you point at the attachment. It doesn't tell you. Tell me. No, point. Show me how it's attached. So first you hold the bone, and first you locate the intertrochanteric line. So the capsule will be attached to the intertrochanteric line here, anteriorly, and then it will be attached proximal to the intertrochanteric crest. Proximal to means the intertrochanteric crest is extracapsular, outside the capsule. Okay, so intertrochanteric line anteriorly, and then the base of the greater trochanter, and then we have here proximal to the intertrochanteric crest.
Is it covering the fossa?
No.
It's above the fossa.
Above the fossa. Okay, so this will be the attachment of the capsule for the hip joint.
And inferiorly, it just
Inferiorly, just surrounding the neck.
So the intertrochanteric line is part of the capsule.
Part of the inside the capsule, but the intertrochanteric crest is outside. So this means that the capsule a little bit deficient posteriorly also. Midshaft. Between the upper 1/3 and the lower 2/3. And because this one has poor blood supply also, so it tends to do the malunion part.
so dialogue.
No. Can also. But the most common will be between the upper 1/3 and the lower 2/3. And of course, the most common will be fracture neck. Fracture neck of the femur. So growing end of the femur. So in case of the lower limb, we say from the knee ifili. So means that the nutrient artery will be going up from the knee ifili. I go away. So this is the direction of the nutrient artery. So this means that the growing center are going to be
Distal.
distal. Femur will be the growing end.
Oh, wait.
Okay.
Opposite of
From the knee, I flee.
The elbow,
towards the elbow.